Hello, everyone. This is Jacob Delk, and I will be talking about the analysis of Dolutegravir and the comparison of the standard three-pill ARV. So, a little history about the drug and what it's used for is a little history about HIV and the emphasis on South Africa. So, in the past history, there has been a large-scale spread throughout human contact throughout the world, but mainly in South Africa. The main mode of transmission that needs to be combated is been sexual intercourse. Um, there was a huge breakout and through the government with their methods of trying to treat and contain, but the main president and Ministry of Health, Mbeki and Montu, had such strong denialism that it affected policymaking and did not approve of any sort of treatment, and so it quickly added to the number one cause of death for the ages 15 through 59. And as the picture illustrates on the right, the HIV t-shirt campaign was very popular with activist groups trying to get the government to take action against HIV. This is Nelson Mandela, who his eldest son was lost to battling HIV and AIDS, and so he took this as a very strong position personally, and he stepped in and added the shirt to show that anyone can be HIV positive and that it's not a death sentence, and the time for action was now. And today, with HIV in South Africa, there are approximately 7.1 million people living with HIV, with a prevalence of 19% in the adult population. And while this is a huge population living in South Africa with this disease, only 56% of children and adults of people infected are on some sort of antiretroviral treatment. The highest HIV prevalence rates have been measured among men who have sex with men, transgender women, sex workers, and people who use injection drugs. Some history about the drug use with HIV. In 1987, the first antiretroviral drug, ACT, also called butamivudine, slowed HIV's progression throughout the body with slowing down replication of the virus in the body. But as it says later, early in 1990s, this was only a use of monotherapy, which was a drug therapy only used with a single drug. And as that had improvement of not taking anything, it ultimately did not show very much progress as it was only combating very little of the disease. But in 1996, scientists developed the first test to measure the CD4 count, which is basically how much of the virus is throughout your body and how well your immune system is suppressing it. This allows medical professionals to accurately measure the progression of the HIV virus inside. This will help them determine a drug therapy to use and what type of route they need to be going on through their lifestyle. Later, they started using the combination therapy, which is a use of multiple drugs, which contained at least three, two of which being from a different class of drugs, and a combination of ARTs and HART, which is a highly active antiretroviral therapy, showed to be most effective using the combinations of drugs immediately after diagnosis. When comparing the history of the antiretroviral therapy for today's use of medication, it's definitely a huge difference. In the 1990s, you could be taking up to 20 pills a day at different times of the day. You could be taking morning, afternoon, and night of all different sorts of drugs. While today, with the new drug that has been introduced in the past few years, You can be taking one drug that delivers multiples in one dose. You can also take it once per a week, and they're trying on that lately, but we'll get to that in later. So a little discussion about how the campaigns in South Africa with HIV affected people's lifestyles. Since the 1990s, there have been numerous campaigns to fight the negative stigma that comes with being HIV positive and encourages treatment through the government and private sector about doing research and development for HIV positive patients, such as the HIV positive T-shirt campaign, the UN AIDS, the ABCs, Fight AIDS Not People, I Am Responsible, and One Love. So one emphasis that I would like to focus on is the burden of HIV economically. In the sub-Saharan African countries, South Africa has the highest on average care per patient per year, with a range as low as $400 per year, but also as high as $2,700 a year. And the average per patient was around 850 in outside of South Africa, while being in South Africa, the average was $1,200 per patient per year. And as that might not seem a lot for us Americans with the US dollars, that sub-Saharan African countries use the rand, which is approximately 12 rands to every dollar. So in South Africa, $1,200 could be their entire yearly income if they're living in some of the poorer areas. Um, with this cost estimate, the it could include the cost of their ART drugs, their laboratory tests, inpatient care, other infections, which commonly include TB, as they are going hand in hand with a uh, decreased immune system and the constant clinic visits for these other infections, chronic cares, etc. And while ARTs could account for one third of the cost in South Africa, it is much more common that the ART drugs could be half to three-fourths of your entire costs outside of South Africa. The burden of HIV with the lifestyle was a constant negative stigma around being HIV positive. They would People in your area would definitely analyze and overanalyze everything you would be doing, such as grocery shopping, clinic visits, being labeled as sinful. Grocery visit shopping, for example, if you would go to get some of the recommended vegetables and fruits that some of the denialism was encouraging, like the South African potato, lemons, and garlic to combat your HIV virus, which today is nonsense, but back then it was a way of trying to treat it without going through medication. Um, if people were to see you buying these things, they would automatically assume you had HIV. If they saw you go to the clinic, they would automatically assume that you must be sick or ill. And if you were going to the clinic, you could have a high chance of having HIV and being labeled as sinful of doing sinful acts. If you are on an ART treatment, and you were not adhering to your medication, and the medication will not be working anymore because the HIV virus adapts and it becomes ineffective, you were labeled sinful on your medical chart. So not only through the community were you labeled as sinful, but also in the clinic staff, and also with the pill fatigue. This would add to the trouble with adherence. It's the back in the 90s, it was much more common because you would be taking 20 pills a day, multiple times a day, and for the rest of your life. And with that kind of burden, having to carry these pills with you throughout the day, of trying to live a normal life, of taking these pills, all the time and making sure you take them on time. It definitely got tiring, especially when you were doing this year after year. Many people would also just kind of throw in the towel and say, I'd rather not do this anymore. And so this added to being a burden of having HIV. With this major breakthrough with Dolutegravir, it was announced in 2017 uh, by Bill Gates at the UN General Assembly. This drug is actually significantly cheaper than the current medications. It has been proven to be more effective and more efficient through patient standpoints and clinical standpoint of being treated with HIV and using this one drug as compared to the standard three pill ARVs. So what's interesting about this drug is that it has the a capability of administering multiple drugs at once. It has a releasing mechanism built into the drug that releases into your system throughout the day. If your treatment is for multiple times a day, it has the ability to release these drugs throughout the day with food or drink, and this way, you only take one pill in the morning, and throughout the day, it will continually release these drugs throughout the day. And some other versions of this drug also have the ability to release these multiple little drugs inside of it throughout many days, up possibly up to a week. And since it's cheaper to manufacture, uh, it can lead to more production and consumption of these medications. So the percentage of uh, people infected will rapidly increase as the price of these will drop and uh, the easier they are to take since it is only one pill instead of the multiple. People can choose to take this first and start from there, and this will start them on their ARV treatment as opposed to waiting and waiting and not being on it. So a little economic analysis of the drug as compared to the standard three pill ARV. The standard three pill ARV is a combination of two or more classes, with the initial six being around nucleosides, which are also called nukes, non-nucleoside, which are non-nukes, integrase inhibitors, protease inhibitors, chocomine co-receptors, and fusion or inhibitors, which these are all kind of costly to produce and distribute. So just on the basis of having the drugs, you are taking one as opposed to three or more, three being a minimum. So automatically is being cheaper to produce for the clinicians to handle and for the patients to have. Another standpoint of looking at the economic analysis of the drug, one big issue that I've mentioned is adherence to your standard three pill system. Um, if you have a new therapy regimen, it adds to the chances of if you do slip up and not adhere to your medication, it does not, it can add to your number of chances to get back on a new drug. That way, you are not running out of options as quickly as you used to. Um, which, if you did have to start over, you only had one more shot of getting on a new pill regimen, and after that, you would have to do an very expensive DNA analysis of individually of your own DNA to see which drugs are working better than other drugs combating the HIV virus inside of you. And with this drug, you have a better chance of sticking to the adherence when it's only one drug once a day, maybe for multiple days or once a week. It decreases the amount of time you have to take it, which is more times you'll adhere to it than others. Looking at the country as a whole of South Africa, the home of the largest population of HIV people in the world. It also stands up the largest ART program is also in this country. So focusing a treatment that would adhere to this area of the world would mostly benefit a high proportion of HIV positive people. Um, and so management and treatment of people with HIV in South Africa is estimated to be roughly $36 billion US dollars for 2020, which in the rand is somewhere around 427 billion in their currency, which is hugely proportional to any other major uh, standpoint of treatment, of care, of healthcare, of actually comparing it to any budget such as military, education, and such like that. So when looking at all of this, the less pills you have to take, the amount of people struggling with adherence will decrease. So the amount of people staying on one drug and being living an effective uh, happy life will increase. The cheaper drug, easier to access, the patients will be more patients that couldn't afford it or couldn't adhere to it will be able to take these drugs, adding to the amount of people who are needing this medication. And then a cost effectiveness study done on this drug as compared to the others found that this new drug was average savings of 13,000 rand and found the estimated ICER of 38,586, which is astronomically better than what they're currently doing. When looking at a supply and demand of this new drug and compared to the standard three pill, with only one pill and much more affordable by the government and the individual, the HIV population, supply will need to rapidly increase, and it probably will due to the fact that it is cheaper to manufacture, and there's much more availability for this drug to be purchased. While the demand will not change, uh, the demand for this drug will increase simply for the fact that the people that currently have HIV that are not on a medication will start, but for the amount of people that can possibly take it are still limited to the people who only have this disease. And hopefully, with new uh, societal changes, behavioral changes, and uh, pharmaceutically, the treatment of HIV will become much more modernized and hopefully soon a cure. And some of the terms here are ARV, which is an antiretroviral, and then ART, antiretroviral treatment, HIV, the human immunodeficiency virus, and supply and demand. Thank you for everyone that is listening, and I hope you have a wonderful day. And these are listed my references if you would like to check any of them out and do any research on your own about HIV, AIDS, and South Africa, and any of the current medical treatments that are being available. Thank you.